Health authorities warn the federal government's plan to slug patients a $7 GP visit fee would see an extra 300,000 flood into overcrowded emergency departments. And they say that hospital visit could cost patients more than $30 if the cost of administering the scheme is passed on.
Our emergency departments are already buckling, but a Senate inquiry's heard the proposed $7 GP co-payment would pile on even greater pressure as patients avoid local doctors.
We're anticipating another 290,000 extra presentations in our emergency.
Sending waiting times soaring.
The average time to be seen in the ED and it would go from 20 minutes to 66 minutes.
We are very concerned that lives may be put at risk as a result of this federal budget.
There can be no more damning indictment of a failure in terms of health policy than that statement from the nurses.
The state government bracing for an $80 million budget hit to offset the ED influx.
They're going to be overrun with people who stop going to their GPs and start rushing into the free service at the public hospitals.
But will it remain free?
You would have to put a rather large levy, would be much larger than the proposed co-payment at the moment, to enable you to recover that cost.
That cost could be upwards of $30.
It's speculative because there's no guarantee that we'd be implementing it in South Australia.
We won't be heading down that path. There's no policy decision by our government.
The Premier's prepared to lock horns with the PM personally as he flies out for tomorrow's COAG meeting.
And we're trying to campaign to make sure that Tony Abbott drops his $7 co-charge.
But the PM's not for turning.
They are just playing politics with this, and it's surely fair and reasonable to have a modest co-payment for visits to the GP.
Tom Richardson, 9 News.